Welcome, Melissa. I appreciate you taking time to talk with us today. Could you tell us a little bit about where you currently work?
Yes, I'm Melissa Heinen. I'm with the Institute for Intergovernmental Research, also known as IAR. IAR is one of several training and technical assistance providers within the Comprehensive Opioid Stimulant and Substance Use Program. And my area of expertise or support for the field is within the OFR or Overdose Fatality Review work.
Fantastic. And how did you come to do the OFR work? You were actually in the field before you were a training and technical assistance provider. Is that correct?
Yes, really nice to be in this space after my experience working in the field. So I started out, I've had a long history in nurse and epidemiologist, working local and national, working in injury prevention, which included suicide, homicide, overdose, primarily for like over 20 years. And I've always had more complicated jobs than I probably should have, where I've tried to do prevention and data work because I really felt that they shouldn't be separate. They should be informing each other. And so when I was at Minnesota Department of Health, my last place of work before here, I was the lead for the National Violent Death Reporting System within Minnesota in the epidemiology space. And so was looking at that data, which if people aren't familiar, it captures information from the coroner, medical examiner, law enforcement, death certificate, and it combines it to try to really understand the circumstances right before the death, where there could have been intervention to kind of understand themes and prevention. And at the same time, I was the director for the suicide prevention work at the state. And so was trying to implement programming funded through SAMHSA and really kept seeing also the data trends, which populations were having increase in suicides, and trying to like weave all of this information together. And so began through that process of piloting some suicide fatality reviews with specific targeted demographic groups where we were seeing increases or consistently high rates to try to inform our prevention efforts and our state plan. And then from there, transitioned and did some murder suicide fatality reviews, and then ended up piloting for the city of Minneapolis within the health department role with my team members excuse me, an overdose fatality review. And I was a facilitator on that review, bringing my experience doing the other fatality reviews, and worked with the program staff, and then also got to work with Mallory O'Brien at the time in that pilot. And through that effort, we started to see some key components to make a successful fatality review. And then through that was able to transition then into this role and bring my data experience and my experience in the field.
And for those that might be unfamiliar with the basic concept or value of a fatality review, what are the benefits? What's it basically look like?
Yeah, so a fatality review is more than just coming together and reviewing the individual's life across all their interactions with systems. What you really do is you bring together this multidisciplinary team. So when you think about your community or jurisdiction in which you're wanting to do prevention efforts, you do a scan and you try to identify different service providers that an individual who died of an overdose may touch or could touch that might be beneficial for their prevention or intervention to prevent their future overdose. So you're thinking about behavioral health, criminal justice, public health systems. Like it really can vary. And you bring this team together and you start looking at the aggregate data. So you look at your population data to really understand community context, social determinants of health, trends, drug use and overdose trends, any sort of data that your partners feel is pertinent to help the whole group understand what's going on in your community. And then from there, you identify that your data really helps you get a high view, like a 3,000-foot view, but you have a lot of questions left that you want to understand. Like, why is this population dying in this community from this substance? What is unique about them? Like, how can we try to tease out where we could have done an intervention earlier? So then what you do is you identify a group that you want to better understand all the circumstances, and you pick some cases. So you work with your coroner or your public health or some entity that knows who has died in your community that meets that that theme or that inclusion criteria, and then you review the decedent's life. So you try to understand from as early trauma in their life to their substance use patterns, to the services they used, if they were involved with criminal justice. And then you can also incorporate next of kin interview, which really does a nice job of providing sort of the narrative for all of the different pieces of information that you get from your partners. And through that, you begin to see, if you do 2 or 3 cases in a review that meets a certain criteria, you start to see some themes or some areas, some pressure points in the community where service providers could step up or coordinate more together to really fill in those gaps and address the needs of an individual who's at risk for a substance use overdose death. And through that process, you can begin to make recommendations to those service providers or the community at large in areas where if they just did slight things sometimes, maybe it's just enforce or reinforce a protocol or policy, or maybe it's setting up an MOU for better coordination. But through this process, you begin to make real meaningful recommendations and changes to address areas you've identified that kind of missed the opportunity before for others. And through this process, then you begin to work with your prevention partners and begin implementing strategies. And so it's this whole life cycle from looking at aggregate data to really understanding what's happening through a shared collective data sharing process and conversation, and then beginning to implement strategies to make changes.
So you mentioned data sharing. So I'm guessing that brings us to where there are a lot of legal questions. So do you want to talk us through some of the legal issues that come up when you're doing OFR work?
Yeah, so it can vary by jurisdiction and by the agency that's leading the effort. So when I was in Minnesota, we originally started with a pilot in the community and had the health department, the state health department lead it, because we had public health authority to investigate and sort of rally around to understand epidemics or concerns to the public. So we used that public health authority to do this pilot with our local city. Not every state has that ability or the resources or that authority to do something like that. And so there are various mechanisms that can be used to address it. And one of the things we realize is while there are so many OFRs that are starting, and there's so many different states with different rules and authorities in place and statutes, and also local jurisdictional parameters, that we really felt it was necessary to establish and provide for the field a model law that was built off of other similar laws around overdose fatality reviews or other fatality reviews, and had the wonderful opportunity to work with LAPA. And through that process, we've been able to promote that model law. And that has really helped a lot of communities come together and begin to understand where their statute isn't supporting data sharing. And many have begun to use that model law to start to move the needle on data sharing in their state. Having said that, we knew that it was going to take a while for every state to adopt this model law and get it passed and then implemented. So we also were able to work with LAPA and put together information sharing guidance documents. So we have questions such as, how and can I get data education records for someone who has died? How do I get behavioral health records? How do I get just health records, right? Medical health records. So criminal justice records, all the various key stakeholders. And really we're able at least to explain the federal law that surrounds those data sharing practices or hindrances, so that people could accurately communicate an interpretation of what federal law said, and then they could begin to work within their organizations with their legal counsel to try to understand, okay, at least this is the federal parameters. Now, what are our state and what are our local? And those have really helped explain and remove myths about how limiting federal law can and always is. And that sometimes you can use some other components like public health authority or other things locally to help address some of those information sharing concerns.
Those are some incredibly helpful resources that you pointed out. And then if people still have questions after they look through the documents, is there an opportunity to discuss further, maybe their particular questions or nuances with you and with LAPA?
Yeah, so really good question. And that's one of the things that I most enjoy about my job is problem solving. All those years working in bureaucracy gave me the ability to figure out how to through problems. So people are always welcome to reach out and request a one-on-one call where we get to better understand what the true heart of the information sharing hiccup is, or any sort of implementation hiccup is. And then what we do based on that is we can do one of three things. We can give you a multitude of possible avenues to work forward to mitigate what you're seeing as a hurdle, or we can connect you with someone in the field, a peer who has had, we know, similar issues and have been able to overcome them. And also, thankfully, we can work with LAPA and see if they can come join a call and help troubleshoot some more. And through that, we give, I believe, most contacts enough information to then go back within their institution or agency and really navigate their next steps, because it's ultimately up to them and their legal counsel on how they want to go forward. The one thing we really want teams to be clear of is, while we put out the practitioner's guide for implementation for OFR, and we also have all of these tools, and we now have national standards, we really want people to understand that you can have perfect be the enemy of good. Like, you just start with what you have. And if you only have two partners that are willing to come and actually give and bring and share data because of their comfort and understanding of what's allowed, then you start with that. And you will find that there are a lot of things that can be done to make meaningful change, even if you don't have a full table of data shares. Those other data shares are always welcome, as long as they sign the confidentiality agreement, to come and listen and participate, and they can begin to provide context around their just general policies, procedures, and practices. Maybe not client specific data yet if they aren't at that point, but you'll find meaningful collaboration and partnership will come out of those conversations.
And all of those one-on-one consultations, are those at no cost to the requester?
They are available regardless of funding, so you don't have to be a COSUP grantee. We are blended funded through CDC and BJA, but even if you don't have funding, you can reach out and we will provide support. It's an amazing service available.
And what are you observing around the growth of OFRs nationally?
Oh my gosh, it has been so fun to see it take shape and just grow as a strategy communities small and large are using. I think the thing that's been most interesting for me and makes sense is, as the implementation has evolved over time, I think some states were wanting to think through, how do we pilot this, or what do we do in this space? But we're finding, as more of their local jurisdictions are trying to dig in on this and trying to answer similar questions about how do we do OFR, that we're seeing the states really step up and try to identify their role in supporting local jurisdictions. So we've been doing a lot more intentional support of and reach out to states and try to help them understand, what does it look like to build a state infrastructure to support local OFRs? Because us identifying and working one-on-one with every OFR as they pop up over time is not going to be sustainable. And the more we can work with states that they can build into their program and their grant writing and all of that, how they're going to support OFRs. And that doesn't mean necessarily fund them. That means things like, think about the statutes in place, whether you need to try to find a way to do the model law, whether there are standardized templates for data sharing or confidentiality that meets your state's needs. One of the things we're encouraging all states to do is to take the National Practitioner's Guide and make a state-specific one where you can really call out your state information. And so through that, I think we're really building more sustainable support that is consistent and standard across the field. And then we know at the TTA level, provider level, who's doing what and how do we elevate that and model that, as well as how do we still support those local jurisdictions in partnerships with states. So in some states, it's just they're not able to do it. They don't have the bandwidth. It's not on their radar right now. So we know in those states, we're going to need to be more intentional about what are we able to do for local OFRs. But there has been so much synergy, so much energy, and we're starting to see implementation of the work that all of this has resulted in. And it's so fun and gives me goosebumps to see the data actually informing how the field is responding to the opioid and overdose epidemic, and really eager to see even more going forward as these young teams start to make significant changes locally.
And you mentioned up, and for people who may not be familiar with what that funding stream is, would you like to highlight that before we wrap up?
Sure. BJA has a funding opportunity and program, which is comprehensive opioid stimulant and substance use program. And this program funds local, state, and tribal communities to build partnerships with criminal justice and other partners such as public health to really address locally and at a state level their overdose substance use and needs. And it is comprehensive in what you are able to do for strategies and implementation. And you can learn a lot more of it either on the COSAPresources.org or by going to BJA specifically. But it is, I think, an underused, underrated resources that a lot of communities who find out about use and then use again, they apply again, and it really has advanced their community's efforts. And so I encourage everyone to take a look at that opportunity as it comes around annually thus far and begin to think about what their community could do to apply and address their substance use and overdose prevention efforts.
Wonderful. And a number of our teams have been funded under the COSUP grant. It's a great opportunity.
They have.
Well, thank you, Melissa, for taking time to chat with us. You've mentioned a number of resources that we'll put at the end of your talk. So thank you.
Thank you. I always love talking about this. I appreciate the opportunity.